If you're a postpartum mom frustrated with constant back pain every time you bend over to lift your little one, or every time you try to push the stroller, or anything you do causes back pain, this video is for you. In today's video, we're going over 5 simple core strengthening exercises that are safe for pelvic floor healing and core healing after having a baby. Welcome back to my channel, and if you're new here, hi, my name is Shri and I'm a board certified physical therapist helping postpartum moms just like you regain their core strength, heal their pelvic floor, and improve nutrition all in 15 minutes a day. So let's get started with today's workout. So before we start, this workout is part of the low back pain series on the channel. So this is video number 3. If this is the first time you're working out or managing your low back pain, I highly recommend starting with part 1, where we go over the foundations and eventually working your way to this workout. This is part 3 of the series, so we're diving more into moderate to intermediate core exercises. So if you haven't done any exercises, go ahead and start with part 1 and then come to this. But if you have been following along the series, then let's dive in. For your first exercise, you'll get on your back. So remember to go on the side and you go over. Once you're on your back, you'll lift both the knees up. Activate your core by tilting the pelvis, and then let's gently drop the legs down one at a time. Good work. Have the hands on the belly so you can really feel the core tightening. And then we're doing this 10 on each. Good work. Remember deep breaths in through the nose and then out through the mouth. So take a deep breath first, and then as you breathe out, you lower the leg. Good work. We went over this basics of breathing in first part, so you probably are familiar, but just remember not to hold your breath. Good work. The hands on the belly are for you to feel your core tightening every time you drop that leg down. Good. And make sure your back is nice and flat. We don't want any arching. Now if this feels very difficult, go ahead and put the feet on the wall or use a stool to rest your legs and then gently drop them down. Good. Give me one more. And relax. Nice work. Now for your second exercise, we're going to go ahead and roll onto your side. Good. And we're going to do modified planks. So have the elbow and shoulder in one straight line, and then pelvis rolled forward. I want you to lift up. You count 2, 3, and then gently come down. Good. Let's do 10 of these, slow and controlled. Nice work. So with this, we're really activating your obliques. Good. And relax. So even the obliques are not directly affected during your delivery, but because they play a key role in supporting your low back and any movement that requires your core muscles to work, it is important that we consider strengthening the obliques that are on the side. They're not just six-pack muscles, but they're equally important. Nice work. Remember, you breathe out and then lift up. Good work. We're halfway there. Nice. Now make sure your hip stays rolled forward. If it's back like this, you are not activating your obliques currently. Good work. Slow and controlled. Good. Give me 2 more after this. And then also keep in mind that we want this to be one straight line. So we don't want it too far forward or back. Good. Let's do one more. And relax. Good. Let's go ahead and switch sides. Same position. And then go up. You pause. Down. Good. 10 of these. Slow and controlled. Now at any time you feel like this is getting too hard and you need to rest, that is totally okay. Listen to your body. If you need more breaks, that is okay to pause and take a break, sip on some water. But also I don't want this to be too easy for you. So if you feel that you can maybe do just 2 more before you take a break, try to push yourself just a little bit. That way you want to get out of your comfort zone. That's the goal. That's when we are actually pushing the muscles to get stronger. If we keep doing the things that feel easy and comfortable, yes, while using those muscles, then you might get your strength back, but it's going to take a lot longer, versus if you push yourself just a little bit. But again, you have to listen to your body. So if things start feeling hard or if it causes more pain, it is okay to stop, back off. You don't have to keep pushing through the pain thinking, oh, this is good, and if there's no pain, no gain. That's not the situation in postpartum recovery. So the key is to listen to your body. Good. Nice work. Give me 1 more. And relax. Amazing. Now for your next one, we're going to go ahead and get on your knees. Point the feet out so it's a little wider. What I want you to do is you go ahead and sit on those heels, and then we're going to come up nice and straight. Good. But remember a V, so your feet on the back are a V, and then your knees are out straight like this. Good work. Slow and controlled. Keep your back nice and straight at all times, especially when you try to come up. Don't lean forward. Nice and straight, and then use the core to pull you up. Good work. Slow and controlled. Keep on going. Now with this, every time you come up, you breathe out, and then as you're going down, you take a deep breath in. It is very important to understand how you're breathing during your exercise, because if you do the opposite of how you should be doing, then you will get tired quickly, but then you also are working your muscles more than they need to. So it's going to take you longer to regain your strength and heal those muscles. Good work. 3 more. Slow and controlled. You're doing amazing. You showed up, you're doing the work. That is really good, mamas. I'm really proud of you. 1 more. And relax. Nice work. For your next 2 exercises, let's go ahead and stand up. For your 4th exercise, we'll start in the center of your mat. We're going to go ahead and go to one side, and then when you come up, you bring the leg up and then rest. We'll do 10 on each side. Now, if you feel uncomfortable, have a chair in front of you or a wall you can hold on to. And then once it gets easier, you can do it unsupported. But I do want you to try it first without holding on, and then use support if you feel unsteady. So let's go ahead and go on this side and up. Perfect. Let's do this 10 times. Good work. Now, you breathe in when you do this, and then when you lunge out, you're breathing out. Oops, there we go. Good work. So with this, yes, you're working your hip muscles, but you're also using your core, balancing in this position. And this is really functional, because think about how many times you have a little one on your one shoulder or one hip, and then you're trying to cook. You have groceries to carry, you have to carry your car seat, push a stroller. So often you're trying to multitask, and that's where your core muscles come in. If they are weak, they're not going to support you. You'll lose your balance, you can injure your low back muscles, you can have hip pain. So it's really important to work on your balance as we are working on strengthening the core muscles. Good work. Give me a couple more. Now remember, you can always pause in between. Take breaks as you need, but remember, push yourself just a little more. Good. And relax. Good. Go ahead and shake out those legs. If you need to sip on some water, feel free to pause. And then we'll go on the other side. So same thing. Let's start in the center. And then we lunge side. Come up and down. Okay, when we are ready, let's go. Good. And you might notice that one side feels easier to balance on than the other. And that's completely normal. That's usually how your dominant side is, and that's what your body is used to doing things more on that side. But with this, we are training both the sides equally, both the sides of the core muscles to equally activate. That way, whenever you do more of your functional tasks, holding your little one on one side, carrying the groceries on the other, no matter which side you have the little one on, both of them are equally strong enough to support you. Good work. Well, one more after this. Few more minutes to go. Keep going. Don't give up. I know there are a million things you could be doing right now, but showing up, doing the work, that for yourself, that's amazing. And I'm so proud of you for that. Let's do one more. And relax. Perfect. Shake out those legs. Good. And last one. Let's go ahead and spread the feet wide. Point the toes out. Think about sitting in a chair and up. But just the difference is instead of your legs straight, they're pointing out. Your back is nice and straight. So no hinging forward or backward. Nice and straight. Ribs stacked on your pelvis. Go down and up. So when you go down, no leaning forward. Make sure everything is nice and straight. Good work. 10 of those. Slow and controlled. Good. Remember, breathe out as you go down, and then you breathe in, and coming up. Good work. Now see if you can go down just a little more. Push yourself, lower yourself. Good. Give me 3 more. Lower yourself. Nice. Good. 2 more. One last time. And relax. Go ahead and shake out those legs. Give yourself a pat on the back. That was so good. But before you leave, let's stretch up. That way we are not sore tomorrow. Let's get down back on the floor. Good. Spread those knees. And then slowly walk yourself down. Straighten up those arms. Good. Let's hold it there. Good. Now gently drop your head down. And relax. Let's come up. Good. Get the hands behind you. Lean back. Look up towards the ceiling. Drop your head down. Good. Hold it there. And relax. Come back. Come to a seated position. And let's go ahead and have one leg out. Good. Now with one hand, push the knee. And let's go to the side. Good. Feel a good stretch in the inner thigh and the side of your back. Good. Make sure this knee stays down. So use your hand to push it down. Good. Go ahead and switch sides. We're almost there, mamas. Good. Push the knee. Good. And relax. Perfect. Last one. Bring those feet together. Good. Wrap those fingers around the toes. And then let's lean forward. Good. Squeeze those shoulder blades, keeping the spine straight. Don't round the shoulders. Good. Hold it there. Deep breath in through the nose. And as you breathe out, lean forward. Hold. And relax. Nice work. That was amazing. I'm so glad you showed up for today, did something for your own self, because that's what matters. Every time you take care of your little one, their families, and your health gets the last priority. But doing this workout means you prioritize yourself and your recovery, and I'm so proud of you for doing that. Now, if you found this video helpful, go ahead and make sure to subscribe if you haven't already, so you are always updated when I post a new postpartum tip or resource on my channel. But also, I have a full 6 weeks of recovery program to heal your core and diastasis recti. So if that's something you're interested in, if this video helped you, you resonated with it, I'll leave a link in the description below. So make sure to go ahead and check out the course. It's 6 weeks of recovery program. Every single week you get an exercise video so you know exactly how to progress and heal your core. And there's even more tips on how to improve your posture, finding time for exercise, because I know that's the #1 question. You have feeding schedule, sleep schedule, diaper changes, finding time to exercise is hard, and I get it. So we have a training on how you can find time to exercise, even if it's 5 minutes, 10 minutes. So make sure to go ahead and check out the course if you need more support. If not, I'll see you next week. Bye.